time for questions when we're all done. First thing I'd like to remind everybody is that we understand this is a holiday season, a very holy week and holy weekend for everybody, but we are asking everybody to please comply with the order that came from the health officer and from the elected officials of this community, and to not gather in groups of more than 10. That means avoiding structured religious services and staying away from each other by more than 6 feet. That is critically important. Though we know that there are some reports out there that we are having better than we planned forecasts for the peaks in some areas of the community, we have not yet reached our peak here in Memphis and Shelby County, and it's important that we stay away from each other. The second thing I'd like to update you on is that we've had some questions about how we are dealing with expanded testing. I'm happy to report that the community has come together, and we have the resources now that will allow us to begin that expansion of testing to those areas where it's hard for people to reach a testing site or for people who are transportation challenged. We don't anticipate that will be broadly available until sometime late next week, but we do have the ability to move forward, and we have a very deliberate plan on how we'll do that. The other question we had is about individuals who are experiencing homelessness and how we help serve their needs, especially if they need to be quarantined. We have a plan for that, and again, because of the generosity of our community, the leadership of our elected officials, we have resources that are going to be able to ensure that they have a place that they can be quarantined. Recently, as early as this morning, you may have heard about alternative care sites in some other communities, and here in the state of Tennessee, you may have heard that there are some contemplated changes in other cities. I want to be clear that there is no change to our plan for an alternative care facility here in Memphis, Tennessee. We are moving forward with build out of our alternative care facility. You heard Mayor Strickland talk yesterday that we have 2 sites that are identified. One would be the primary, one will be the alternate. We do not yet have a contract on the second, and once that is completed, we'll be able to identify where that is. But we are moving forward with an alternative care facility. To complement that, our hospitals are working very hard to make sure that they expand their capacity to absorb the surge. That work is complete, and we know what their ability is to absorb the surge inside all of our healthcare systems. Again, as I've said before, today we are in very good shape, but we know with the surge coming, at least we understand when we might reach that capacity. The last thing I'd like to update before I turn to Dr. Householder is that you may see some changes coming out to other critical services, not just related directly to COVID-19, but one I'd like to call particular attention to, your solid waste or your garbage service. In the city of Memphis, we are asking people to not put household garbage in bags outside of your cart. That could present a hazard for our frontline workers, and so we're asking that all garbage be placed in the cart. There's no change to any of your bulk waste, those things that are yard waste or other kinds of junk, but any kind of household garbage must go in the cart so that we can keep everybody as safe as possible. I'll turn it over now for the health department update from Dr. Householder.
Thank you, Chief McGowan, and good afternoon, everyone. I'm going to give updates on data as we always do, and then end with some of the public health strategies underway, and I'll likely be reinforcing very closely what Chief McGowan has already discussed about efforts underway through the Joint Task Force. As of this morning, we're up to 949 cases of COVID positive individuals in Shelby County. That's an increase of 52 from yesterday. Approximately 53% of those are women, and 44% are men. We will continue to present race data, knowing that all of the data is not currently in the system, but we do believe there are sufficient numbers to have adequate representation. So of the 268 cases that have been entered into the database, almost 68% of those are African American, 28% Caucasian, and 9% listed as other, and that may be individuals who opted not to indicate race or ethnicity. We have tested over 10,000 individuals in Shelby County, 10,642 to be exact. We still continue to have a positivity rate of 9.1%. We have 23 deaths as of this morning, and that's a 2.4% death rate. That's a little bit higher than some communities. We'll be continuing to watch that as we have increased numbers in deaths to see what that means specifically for Shelby County. We still have about 70% of our cases that fall within the age ranges of 21 and 60, and that's important because I've mentioned before the critical importance of protecting our seniors and those who are more vulnerable and those with chronic illnesses particularly. And so the younger group is still most impacted, while we are seeing some increasing numbers in the senior group as well. As far as the hotline, we've received almost 2,400 calls to date, and 144 of those as of yesterday. But what I wanted to reinforce are the strategies that are underway and really say thank you to the community. This is National Public Health Week, and I have failed to remind my staff of the importance of public health, particularly during Public Health Week. But all of the strategies underway are a combination of community-based public health strategies and healthcare system strategies that have support from a wide array of sectors, including our elected officials, our faith community, our healthcare partners, as well as our public health professionals, law enforcement professionals, and so on. I'm going to reinforce what we know locally, but is also now being stated nationally. Social distancing is the key. So adherence to all of the orders that have been put forth, including the health directive around social distancing, is critical. I will reinforce what was noted earlier. We know this is a holy week for many religious faiths, and it's important that as much as we can, that live streaming be the way to be able to worship. But if necessary, if a small group comes together, it has to be 10 or less and have to maintain 6-foot distancing. We will have staff available, as will the city, to respond to any complaints that may come forward in regards to non-compliance to that social distancing order. We are also very heavily focused on early case finding. That's where testing comes in. So what we do know is there are individuals who have very mild symptoms that may not be being tested. So we really want to encourage anyone who has mild symptoms of COVID-19 to avail themselves of community-based testing or to work with their healthcare provider to get testing. The earlier we identify cases and assure that they're isolated, then trace their contacts and assure they're quarantined, we will contain COVID-19, and particularly we will contain and prevent outbreaks, which is critical strategy at this point. In regards to predicting the surge, we have a data team that represents a variety of academic partners as well as governmental partners, and we anticipate that those predictions will be released probably earlier next week. As was noted, there's a significant number of individuals planning for the surge, but I want to end with, if we focus on social distancing and early case finding, the surge will be much less in Shelby County, and that's really where we want to focus moving forward. So I will open it up for questions, and Chief McGowan and I will both entertain questions.
Jessica Gertler with WREG.
Hey everyone, I hope you can hear me. Several private labs are reporting challenges and backlogs. On average, how long are patients in the health department waiting on results, and what challenges and concerns do these delays cause?
So within the health department specifically, we don't have patients who are waiting because we're not doing testing. So it's really our community partners and healthcare providers who don't have information to treat the patient at that time. It also means that a person who is negative may be in isolation longer than necessary because they're waiting for test results. We've heard of backlogs from the hundreds up to about 1,000, and that does pose a significant challenge for us. What is really the important actionable takeaway here is that if someone has been tested, they are to stay in isolation until those test results come back, and that'll prevent spread within our community.
Sam Hardiman with the Commercial Appeal.
Hi, Director Househalter. Thank you for taking the question. My question is today the growth rate from yesterday in positive cases was about 4%. It's been in the single digits the last several days. Is that a sign that social distancing is working? And are there other key metrics that the Joint Task Force is looking at regarding compliance, et cetera, to evaluate where we are?
Thank you. That's a great question. Those are very early indicators to us that social distancing is having an impact. I will caution people that we don't want to lessen or reduce the social distancing too early. My earlier comments were we would expect that we need to do social distancing at least 2 to 4 incubation periods, and so that's anywhere from 30 to 60 days to see significant impact. So we will continue to monitor, but it is positive. There are other things that are being done across the community to actually measure our social distancing. And my understanding as of this morning, our grade went up to a B- from what had been a C, so that means that people are adhering to the social distancing guidelines, and that's going to make a critical impact moving forward.
Bradley Broders, Local Memphis 24.
Sorry. Good afternoon, everyone. Just my question might be for maybe Doug can help answer it. Obviously today the unemployment claims in Tennessee skyrocketed. I know there's some resources. Mayor Strickland mentioned the launch of a call center. More broadly, is there any kind of just message to the community of those where they might be able to look for employment affected by this during this pandemic?
Well, thank you for that question. As you all know, there are programs that are at the federal level that will trickle down to us. We've seen some issues with that being able to be accessed on the ground here, but I have heard some uptick in actual success rate with those programs. That is to be expected. It takes a while for those programs to be made available. I would also say that this is a city of entrepreneurship. We have seen many people express their entrepreneurial spirit, and they're starting, if their existing business is closed, they're starting a new business that can help serve their community, and we applaud that. The call center that we had and we talked about yesterday is to put those folks who are in the hospitality industry to work, and we think that is an important segment of our population that we get to work. Obviously, that's a huge part of our economy. There is another resource for individuals, and that is through our COVID response fund that we have at the Community Foundation that is helping our nonprofits serve other individuals. While it is not employment, it is the provision of additional services that people might need during this time when resources are constrained and when they maybe not have as much revenue coming into the house. So we will continue to look for other opportunities where folks can find work, but quite frankly, it is a difficult time to put on additional work in the community when we have this clamp down on our ability to gather into groups.
Kendall Downing, WMC TV.
Hey everybody, Doug. I had one quick question for you with that, and then I had a question for Alicia as well. The fund, the call center, is there a way for people to apply for that, or is that something that you all are doing with the Restaurant Association? Because I know we were getting kind of some questions from folks after we mentioned it on air yesterday about folks that were interested. Is there a number they can call or a place they can reach out to? How's that being handled?
There is. I don't have the number off the top of my head, but we're doing this in conjunction with Memphis Tourism. And so I will make sure that we push that out more broadly. We'll get a social media tweet out and we'll put it on our website again, just to reiterate what that is. You have a question for Dr. Householder?
Go ahead, Kendall. All right, we'll come back.
I think I'm here.
There you go.
Yes. Okay. Perfect. Alicia, I know that as this has evolved, when we didn't have a lot of testing at the first, and now we've really ramped up our capacity. What you just said is, if you have mild symptoms, go get tested. Where at the beginning, someone who had mild symptoms, maybe it would have been best for them to stay home and not get tested. Is that kind of the change as this has evolved, and how we're seeing and working this outbreak differently now that we have more capacity?
That's a great question, and I would say it is an evolution based on two things. First, we know more about COVID-19 and the presentation of individuals who are positive for COVID in the United States. So what we do know is that many people have very mild symptoms, and so we have to determine if those individuals need to be isolated or not. The early recommendations from the Centers for Disease Control were to test individuals who were symptomatic. However, what I would say is what those symptoms were initially were described as the more severe symptoms. So it's not, I wouldn't say that we're saying early on don't test people who have mild symptoms, is that we have a better understanding of what those symptoms are, and that category of symptoms has expanded. And now that we have sufficient testing, those individuals should be tested, again, because we want to get them isolated and get them contained so that they no longer spread COVID within our community. I'll also reinforce earlier messages that I've said. It's really important with individuals who are employed and still going into the workplace that if they have even very mild symptoms that they do not go to work.
Bill Dries with the Daily Memphian.
Yes, I have two questions. The first is that we are hearing that there was an effort to test some children who were in juvenile detention, and that testing wasn't able to take place for some reason. Does anyone there know anything about that?
So I will not give full details today. I can give more of an update probably by tomorrow. Keep in mind that if there's an exposure in any facility, that includes a detention facility or a correctional facility, contacts are identified just like they are in any workplace or any other congregate setting, and individuals are quarantined. Typically, testing is not recommended unless individuals are symptomatic. And so we're trying to, as much as possible, adhere to the CDC guidelines and quarantine appropriately and test when appropriate. But more information on that coming up.
All right. And my second question, I think I went over this with someone from your office after yesterday's call. Mm-hmm. Other cities have numbers for folks who are currently in the hospital, in ICU, on ventilators and things like that. Why are we not able to have those figures here?
So it's not so much that we don't have them for planning purposes, we cannot release them to the public at the current time. So the state of Tennessee has a healthcare resource tracking system that's a state database, and within that database things are reported such as bed availability, bed capacity, and then recently there was a survey added to that system that looks specifically at individuals diagnosed with COVID, individuals who are under investigation, individuals that are in intensive care beds, and individuals that are on ventilators. We do not have permission at the local level to release that data at a local level. What we, as a task force, are looking at is what data sharing agreements need to be in place so that we can share what's needed with the public and how we can share information with each other that's necessary. So at the current time, that information is available to us for planning, but we don't have permission to release it.
George Brown with Fox 13 Memphis.
Hi, Dr. Householder. The first question was, as you know, the feds or federal government is pulling out support for testing sites around the country starting Friday. And I know every area is different and the testing sites are run by different groups. Do you know if that has any effect on Shelby County? And then I have a second question for Doug.
Sure. Good afternoon, and that's a great question. The testing group actually met earlier today, and one of our questions to our partners, particularly the safety net partners, was whether or not that change at the federal level was going to negatively impact their ability to do testing. And the response was no. And that's for several reasons. One, there's additional testing available through the CARES Act, which is a separate funding source. And then at the local level, the city and county have come together to look at what resources we need to bring to bear to help continue the testing that's necessary in our community. And I'll turn it over to Chief McGowan since you had a question for him.
Thank you.
Great. Hey, George.
Thank you, Chief. Hey, thank you. So we, as you might imagine, have been getting a lot of calls from people who unfortunately may be disabled or housebound, and they're asking if there's anyone that can help them with groceries, shopping for them, that sort of thing. And I know that there's been some faith-based help through individual churches and something. Do you know of any maybe central way that they can get help?
Well, there are several ways. First, I just want to talk about food in general. The Mid-South Food Bank is a principal source of distributing food for people who need that, and MIFA, the Metropolitan Interfaith Association, also is an organization that meets those needs, and they have an intake process for people who are in need, and so that is one way that we can centralize that need-based, understand what the need is for the community. The other piece is that we have people who are disabled. We have a MATA Plus service for individuals. It's an on-demand transit system for individuals to go where they need to go. And that service remains available, and we actually have a pretty good on-time performance rate for that service today. I want people to know that we are not food insecure as an entire community. The food bank has several weeks and anticipates that here in the next day or two, they'll be back up to a full month's worth of food in the food bank. So we are not food insecure, but as you said, there is somewhat of a distribution challenge for individuals. So I would ask those individuals to contact MIFA, the Metropolitan Interfaith Association, or the Mid-South Food Bank to ensure that their needs are understood. If they simply have a transportation challenge and they are disabled and can't get to the store, then certainly they should call MATA Plus for a reservation so that they can get a ride to where they need to be.
Katie Reardon with WKNO.
Hi, this is for Dr. Haushalter. Quick question: when you referenced our grade going up to a B-, what were you citing? Who's providing those grades? And then a second question, going off of Kendall's question, can you be absolutely clear about who is now eligible for testing? When you say someone with mild symptoms, does that mean if I'm at home sitting with a cough, I can call Tiger Lang to schedule an appointment? How widely available is testing now?
So for your first question, that was a report that was provided in our 8 o'clock joint task force meeting. I can determine the actual source of that data, and Joan can share that with you. In regards to testing, what I'm going to reinforce is people who have been symptomatic have always been able to be testing. It's that the range of symptoms has been broadened. So if an individual thinks that they may have COVID, the first thing they should do is contact their healthcare provider and see if their healthcare provider offers testing. And if not, they may be referred to one of the community-based testing sites. So that really hasn't changed. It's just that there's a broader list of early signs and symptoms that we know of in the United States.
Adrian Sands with the Associated Press.
Hello, everyone. Dr. Haushalter, in the analysis of race-based data when it comes to cases of coronavirus and deaths due to coronavirus, have you seen any instances of Hispanics in the community testing positive, or are they being grouped into maybe the other category? Just curious as to if you're looking at that as well.
So that's a really great question, and that's an area where we have insufficient information and that we need to have more information. So as was noted yesterday, typically laboratory results, which is what we receive initially, do not have race data at all, and we attempt to collect that data when we're interviewing the client, and we have significant gaps in the data. When our team will be interviewing, they would not lump people who are identified or self-identify as Hispanic or Latino within the other category. We would treat them as a separate individual category of their own. So where we have other, it may be individuals who have identified as mixed race potentially, or have opted not to share, or have identified themselves as other. You want to add to that? Mm-hmm.
Thanks. I'd like to come back to one thing that George asked about the food insecurity. I failed to mention, and I apologize for this, for anyone who has any needs, whether you're transportation insecure, food insecure, if you have problems with an individual in your family who just needs some assistance, 211 is the number I want you to remember. Literally for almost anything that you can think of for a human service, if you call 211, they will triage your needs and they will route you to the appropriate place. So I didn't give a number, but the number I want you to remember is 211. Transportation insecurity, food insecurity, any kind of help with social services, 211 will take your call and route you to the appropriate level of service.
Greg Coy with Fox 13 Memphis.
Hey, Greg.
Chief, hello, how are you? My question is to Dr. Haushalter. Going back to the mobile testing, so the people who would go into those, come to you to get tested, they will not need doctor's referral. And is there a copay, or is the copay waived? And again, I do have a question for the chief.
Okay, so I haven't used the word mobile testing, so we've used community-based testing, and there are drive-through sites as well as clinic facilities that provide testing, and our larger healthcare systems also provide testing. So I would say, again, reach out to your own healthcare provider and determine if they are able to offer testing, and if not, identify the closest community-based testing site and then ask what is needed for those particular sites. And I think they're all being listed currently for our customers to be able to see. And so they generally would require or prefer a doctor's order, but each site is a little bit different. What we're really trying to encourage people to do is to get tested if they need to be tested, which means if they're exhibiting signs and symptoms. I'm going to turn it back over to the chief.
Chief, question to you is, do you think, has the corporate community stepped up in terms of underwriting any future or current testing sites that are available, and is there any effort to get them to underwrite any more?
Well, first I would like to say that we're very thankful for the folks who provide the insurance to people in this community. They have stepped up in a big way. They were very responsive to the needs of the COVID-19 response. I know that the major insurance carriers are covering 100% of the treatment and testing cost. And so that is not the norm for many diseases, so they have essentially made it zero cost for testing and treatment. So that is a huge effort. I know it costs a significant amount of money for them to provide that service. We do have, as we looked to the resources to expand testing, we have some anonymous corporate partners who would like to participate in that. And so I can't express strongly enough the level of support that this corporate community here in Memphis, Tennessee has stepped up to the plate to offer to this fight. We have many companies, I'm not going to name them here, who have offered their support, from giving us advice about logistics to giving us advice about sourcing particular products that we may be lacking, to lending manpower and brain power, quite frankly, to the task force. So this literally is a community effort. Folks are involved from every segment of our community, both private, public, philanthropic, and corporate. And this pandemic has unified the community in a way that I, quite frankly, haven't seen in quite some time. So we are getting every level of support that we could possibly ask for.
Catherine Burgess with the Commercial Appeal.
Hi, hope you all are doing well today. My question is for Director Haushalter. I'm wondering if you can tell us if there have been any cases of COVID-19 at senior living facilities other than Carriage Court in Shelby County. And then if you are able to tell us whether any of the 23 deaths have been residents of any senior living facilities.
So the answer to your first question is yes. Whether or not those constitute an outbreak would depend on the number of cases within those facilities. We monitor our notifications daily, and then we also will receive additional notification from the state if there's what we view to be the beginning of an outbreak. So I will say, because I know you guys do your homework, is that we are currently working with another facility to determine if we believe there's an outbreak there, and we will probably have more information on that by tomorrow. We have a team that's working with that facility today. As with the previous facility, I generally try to work with those facilities for them to disclose themselves that we're working with them, and if we don't or not able to achieve that within a timely manner, then I'll release that information either that day or the following day. So more to come on that. I want to reinforce what I said earlier because it's very germane to outbreaks, particularly in assisted or extended or long-term care facilities. Healthcare workers need to stay home if they are exhibiting any signs and symptoms of illness. That's mild fever, a mild cough, something that they may put off to allergies. It's much better to get evaluated prior to going into the workplace and potentially exposing one, other healthcare workers, but also members of that particular residency place. In regards to whether or not there have been deaths associated with any long-term care facilities, the answer is yes. I just don't have the exact number with me right now.
Kendall Downing, WMC TV.
Hey there. One question, clarification I wanted to ask was about the symptoms. I know that you all mentioned that the symptoms, Dr. Haushalter, had broadened. Are there other symptoms that we may not be thinking of that you have seen in research or other things that we could mention to people that they should be on the lookout for?
So there are the things that we've referenced all along, but sometimes they're very mild. So a low-grade fever, someone doesn't have to have a really high fever, a mild cough, a headache, anything that's early flu-like symptoms, and I would think most of us at some point have had the flu or a really bad cold, but the early beginnings of that are oftentimes what's overlooked, and individuals then continue to either go to work or be around others when they're actually shedding the virus and potentially making others ill. What we also know with the senior population, and I've mentioned this before, because they don't mount the same response as the rest of us, they may have things like early confusion. They may or may not be a little bit agitated. They may or may not have diarrhea long before they develop the shortness of breath. So really looking and being attentive to mild changes in our well-being and whether or not those could be related to COVID are important.
One final question. Wendy Thomas, MLK 50.
Yes, I had a question about the racial disparity data that has been shared in the deaths. I understand you're not able to share the city in which the deceased lived, but is it possible that if the African American deaths we see are all in Memphis, then a 70% fatality rate is not that far off of the Black city population? Just trying to see if maybe the disparity isn't as dire as we fear.
That's a very good point, and if you will note, I mean, the numbers are very, very small. And so we can't draw conclusions based on the current data. All we can do is state the facts. And that's what David Sweat did yesterday, and that's what we'll continue to do. So we want to give the percentages, but knowing that there's additional analysis that needs to occur before we draw a conclusion as to the level of disparity. I think the key reason for us releasing that data is there may be some misconceptions in communities across the United States that this is an illness that's primarily impacting Caucasian or middle or upper middle class communities, and that's not the case. So our main actionable point there was that this is something that is at risk. Our whole community is at risk, and everyone needs to take the appropriate action to prevent transmission, and that includes all communities throughout Shelby County.
Closing comment from Chief McGowan.
Thank you.
Thank you all for being here today. I just want to wrap up with just a couple of closing thoughts. We all know that this is a holy weekend for many people, and so again, I just want to reiterate, please stay apart. As the mayor says, we need to come together by staying apart. If you know someone who is in need of service and they just don't know where else to turn, please call 211 and we will route you to the appropriate area for service. If you are out and you see someone who you think is not complying with the Safer at Home order, you can call the mayor's action line, and that number is 222-2300. Again, 222-2300. And finally, if you want to help and you're not quite sure how to do it, we have formed at the Community Foundation of Greater Memphis a fund that is called the Regional Response Fund for COVID-19. If you contact the Community Foundation, they will tell you how you might be able to help in your community.